Thank you very much to the moderators and SAGES for the chance to present our work. This is an analysis of results in a single-blinded, prospective, randomized controlled trial comparing non-fixating versus self-fixating mesh for laparoscopic inguinal hernia repair. And this was a study conducted with an industry-sponsored research grant from Medtronic. Laparoscopic inguinal hernia repair offers reduced postoperative pain and better outcomes compared to open repair. However, long-term pain is still a common complication following laparoscopic repair, with persistent postoperative pain seen in around 10% of patients. Self-fixating mesh is a new development that could lead to improved pain outcomes following laparoscopic repair through the reduced need for tacks. Additionally, self-fixating mesh can minimize the possibility of mesh migration. In our current study, we hypothesized patients receiving self-fixating mesh during laparoscopic repair will report less pain and improved quality of life outcomes compared to those receiving non-fixating mesh. We did a randomized single-blinded trial measuring quality of life outcomes between two polyester meshes. All patients underwent totally extraperitoneal laparoscopic repair, and we only included primary unilateral inguinal hernias. Patients were randomized to receive self-fixating or non-fixating mesh, with 137 patients in the control group and 133 in the self-fixating group. We powered this study to determine a difference in postoperative pain. The self-fixating mesh we used was a hydrophilic monofilament polyester with absorbable polylactic acid microgrips, and the control mesh was a hydrophilic monofilament polyester. We also did a subgroup randomization, so patients in the self-fixating mesh group with direct inguinal hernias greater than 2 centimeters were randomized to fixation with tacks or no tack use, and this allowed us to determine if tacks were necessary for direct hernias with self-fixating mesh. Just a note, typically surgeons at our institution do not use tacks for indirect hernias or for direct hernias less than 2 centimeters. Here's a schematic of our study design. We started with 283 participants, randomized them to the self-fixating mesh group and the non-fixating mesh group, and of those with direct hernias greater than 2 centimeters, only in the self-fixating mesh group did we randomize them again to a group that received tacks and a group that did not. The quality of life measurements in our study, the first one was the surgical outcome measurement system, which was completed at 3 time points. Patients completed it preoperatively, 3 weeks postoperatively, and 1 year postoperatively. Additionally, for the first 7 days postoperatively, patients completed a pain journal. And finally, the Carolinas Comfort Scale was completed at 3 weeks and 1 year postoperatively. Here we have the patient characteristics for each group, with the characteristics listed on the left-hand side. The far right-hand side, we have the p-values, and the control group and the self-fixating group are listed in the middle. The only differences between groups were seen in the length of stay, with the control group showing a slightly longer length of stay. Additionally, the control group had more patients that received tacks, and that was due to our subgroup randomization. However, the number of tacks in patients that received tacks was not different between the groups. Of note, at the bottom, there were no recurrences in either group. For the postoperative pain journal, for days 1 through 7, a higher score indicates a better outcome here. We have the score on the y-axis and the days across the x-axis. And there was a difference between the two groups in the first 3 days, with the control group showing less pain. However, from days 4 through 7, there was no difference between the groups. For the preoperative quality of life measurement for the SOMS system, we have the 4 domains for SOMS listed on the left-hand side: pain impact, pain quality, fatigue, and physical function. And then we have the 2 groups, control mesh and self-fixating mesh, and the p-values. And there were no differences between groups across these 4 domains preoperatively. For the postoperative measurements for the SOMS, we have again the domains listed on the left-hand side and the p-values on the right-hand side. And there were no differences between groups across the 4 domains at either 3 weeks postoperatively or 1 year postoperatively. For the Carolinas Comfort Scale, there are 3 domains on this measurement system. the sensation of mesh, pain, and movement limitations, in addition to a total score. And at 3 weeks postoperatively and 1 year postoperatively, there were no differences between groups in any of these domains. Here we have the pain impact domain for the SOMs depicted. Across the x-axis, we have time from preoperatively to 1 year. And we have the score on the y-axis, and there was no difference between the control or self-fixating mesh, with both groups showing a trend to improvement indicated by a lower score over time. Similarly, for the pain quality, there's no difference between groups at any of the 3 time points, and both groups show a trend towards improvement indicated by a lower score. Same again for the fatigue domain. Both groups show a trend towards improvement indicated by a lower score, and there was no difference between groups at any of these time points. For the physical functioning domain, for the SOM system, a higher score indicates a better outcome. So both groups, again, trending towards better outcomes over time, and no difference between groups. For the Carolinas Comfort Scale at 3 weeks postoperatively, there was no difference between groups in the mesh, pain, or movement limitations domain, and again, the total scores were similar between groups, with a higher score indicating a worse outcome. Again, for the Carolinas Comfort Scale at 1 year postoperatively, no difference between groups on the 3 domains or total score. In conclusion, self-fixating mesh does not provide improved quality of life benefits following laparoscopic inguinal hernia repair compared to non-fixating mesh. Quality of life outcomes in both groups remain high, with a very low incidence of recurrence. Further research is necessary to determine the benefits of self-fixating mesh for inguinal hernia repair.